Can you introduce yourself and tell us what are the types of cancer and when was your cancer diagnosis?
Okay, I'm Richard and I'm from Singapore, but I live in Malaysia for 18 years. So I was diagnosed with NPC, what is that called? Nasopharyngeal cancer, which is a nose cancer in 2023 October. Right. There wasn't a lot of symptoms at the point when I was diagnosed. Just some slight numbness on the face, and the reason that I actually went to the doctor and all was because my nose was getting blocked seriously. So I went to the ENT, ear, nose and throat specialist, which then referred me to the medical oncologist, and then it was then diagnosed that I have this NPC, and it was stage 4.
Can you describe the involved location of your tumor?
With metastasis from my right ear all the way to beneath my brain and then down to my spine.
How did you get to know about ECCT? And why did you choose to start ECCT?
Okay, ECCT, I went, of course, when you get diagnosed, you'll go around seeking for a lot of information about cancer. I believe most patients, if not all, will be like me, or maybe your family members. You'll start seeking information about other cures or other complementary therapies, everything online. You Google information about, the cancer, the type of cancer, the treatment available, and what can be further done apart from the usual chemotherapy or radiation therapy, from the hospital. So during this period of so-called searching for information, I actually stumbled upon ECCT. Of course, ECCT isn't the only one. I saw quite a few other sort of treatment options. So ECCT, I think the key is that piqued my interest really is about, it's non-invasive in nature. So that means non-invasive means that they don't pump anything to your body, they don't extract anything from your body. It's something that's external, so non-invasive in nature. So, and then when I look at all the very impressive testimonial, about their track record in getting other patients, cured. So that led me to further look into ECCT, and then I also realized that they have quite a lot of scientific information and scientific write-up about their technology. So I discussed with my colleagues, because I happen to be involved with a university in the United Kingdom in my line of work. So they give me a bit of access to researchers, scientists and things like that. So we look at it, we ran through it, and yeah, it's interesting, and I think there's no harm to it, and in fact it could potentially be an option for me to look into this, to start using ECCT. So that's why I proceeded with ECCT.
When did you start ECCT, and what are the differences you felt?
I started ECCT when I was doing my just before I start my chemo, and then of course since then I've been using ECCT. The key difference is, when you look at chemotherapy, you look at TV, you look at movies, you look at online, everybody will say chemo is a very strong drug, which I totally agree. And you see people have, very bad symptoms, about vomiting, nausea, feeling very tired, cannot do anything, very unbearable sort of side effects. For me, during my chemotherapy, I was actually living quite a normal life. Of course, after the first 2 days of the chemo, I feel a bit tired. And generally, of course, you are not as, you don't feel as energetic as before. But overall, I don't have that nausea, vomiting, and all those associated side effects which you see on TV or movie about chemotherapy. So I think I credit it to ECCT.
Are you happy with the results of ECCT?
It has shown a big and remarkable difference in my PET scan result after just 3 months of chemotherapy. My oncology was pleasantly surprised, and perhaps more than pleasantly surprised at the result after just 3 months of starting ECCT, and alongside chemotherapy, that the tumor has managed to shrunk by more than 50%, and the density level has decreased by 70% in both the primary site and the metastasis site to my spine. This is not within the expectation to have such a effect, such a positive effect in such a short time, as I've only managed to do 3 cycles of chemo.
What do you think is the key difference with and without ECCT in your journey?
So I think this is the key difference apart from, not getting a lot of side effects from, being under chemotherapy, I think the key was after the third cycle, there is a very significant reduction and reduce of the tumor intensity. And then by the sixth cycle, I finished my chemotherapy, the tumor and they shrunk a little bit more, and thereafter I go for my radiation therapy, which is another month. So even during radiation, I was using ECCT, and after radiation therapy, the doctor was very happy to declare that all the tumors are gone. The main site completely gone.
How did ECCT affect your health and daily life?
ECCT, it didn't affect my health and daily life in the sense that, in fact, it helps my health, and it's very easy to integrate into your daily life. It's just a blanket and helmet, which you do it. For me, it was twice a day, 2 hours each session at the max, right? So it's nothing much. You take it, you do an afternoon nap for 2 hours, or if not, you just lie down there, listen to podcasts, listen to radio or whatever for 2 hours in the day, and then another 2 hours in the night. Night is easy because you go to sleep, right? So you just put everything on, start the device, and then go to sleep. So easy to integrate, and in fact, like I said, it didn't really. There's some slight adjustment you need to make to your daily life, but not that serious, because it's very easy to do it. And then my health, as a result, besides getting the tumor shrunk and getting the tumor cured, it also I think the other ECCT mode was also about enhancing my liver and my kidney, because every time I do a blood test, all cancer patients, you are probably very used to blood tests. My liver and kidney has been very resilient. So my liver and kidney has basically kept the parameters within the very healthy range, which is also a reason why during my chemotherapy I was feeling very good in the sense. So because the chemo drug tends to hit the kidney and the liver quite badly, because these are the two filters in the body, to filter the drugs and toxic away from the body. So during the period of time, it was very good, the parameters. Since day one, I do chemotherapy right till the end. I finish my radiation therapy, my blood test. The two key important sort of organ, which is the liver and the kidney, has been very resilient, and they have stood up very well in that sense. No deterioration, no nothing. So it was all good.
What are the main differences you felt after using ECCT?
After using ECCT, as I mentioned just now about, there isn't much feeling to it. Like I said, it works, it works in the body, but I don't have the side effects about feeling very lethargic, no, I don't have side effect of vomiting or nothing. So in the sense that the key difference about ECCT versus, say, chemo or radiation therapy is chemotherapy, like I said, I was feeling after 2 days of being very tired after the chemo session. I was out running, I even travel overseas and things like that. So it's all okay. But of course, as I mentioned, you won't feel as energetic as you were before you have cancer. But generally, during chemotherapy, you feel a bit tired, a bit lethargic, things like that. Some small effects. Sometimes, some once in a while you feel, maybe I don't feel like eating that much and things like that. But generally, for me, it's okay. So in that sense, radiation therapy, I got some nausea. I didn't feel very well because of the radiation affecting the body. But that is the traditional, radiation and chemotherapy. But for ECCT, the main difference is you don't feel, no side effects. And like I said just now earlier about the liver and kidney, the blood test and all the medical tests has came back very positively about how my body was reacting to all the very heavy chemo drugs and radiation therapy. So it's all good. So this is, to me, the key difference. So ECCT, no side effects. In fact, it enhances my key organs and make me the journey about going through chemo and radiation very smooth, and make it the journey very bearable. I think that's the difference.
How does ECCT treatment fit into your daily routine? Is there any difficulties you encountered with the treatment?
ECCT, something very easy to use. Not difficult. The daily routine, for me, 2 hours in the day, 2 hours at night. So 2 hours, put on the blanket, put the helmet, on the oscillator, 2 hours, listen to podcasts, or, sleep. And at night, no problem. After put it, you go to bed. So the daily routine is very simple. Not much heavy adjustment you need to make to your daily routine. So even when I travel, which I did a few times during my chemotherapy, I bring it along, I pack it into my luggage, and then I bring it along. When I go to the hotel, check in, I do my work in the day, allocate a bit of time, 2 hours to do ECCT, and at night, do ECCT, that's it. So in that sense, it integrates rather seamlessly into my daily routine, so not much issue. So in terms of difficulty, I honestly don't have any difficulty with it because, like I said, it's very easy to integrate. It's not something very invasive. It's invasive. They put something in your body, they still feel side effects, and you feel very whatever, the body react to it. So it's non-invasive. And difficulties, like I said, you don't have to make major big changes to your lifestyle to accommodate the treatment.
Would you recommend ECCT to other cancer patients who are still looking for hope and effective treatment options out there?
I would honestly, given my experience, I would strongly recommend ECCT to other cancer patients who are still looking for, other effective treatment options. Because I think the key is, I've talked about why, ECCT. I think in that sense, the key difference, I think the key thing for me is it's non-invasive. So you don't pump anything in the body, which is very important because you pump anything in the body, things that are not proven. There are a lot of other treatments out there, some are not even proven. So, I don't take the risk to pump something in my body. So this is outside your body, it's not invasive. So, if it don't work, throw it away. It doesn't matter. Nothing goes to the body, right? So the other key thing is have a look at all the different options. Why I was trying to recommend ECCT simply because in terms of absolute cost, you may find that, the cost for ECCT is actually very expensive. But if you look at and compare it relative to other options out there, ECCT is actually one, or I dare say, the more or most affordable. Because like I said, I've seen other treatments, they range from a few 100K to at least 100K, and it's in terms of scientific justification and proven, it's not as much as ECCT. They don't even have testimonial. They have very little. So they don't have all the scientific stuff to back up their claims about how effective it is. And so to me, ECCT is still very recommended in that sense. And personally, I've used it already and it's proven to work. So obviously, since it's proven to work for me, I would say that, obviously, I think it's highly recommended for people who are still seeking for other forms of treatment for cancer.
Richard, pet assessment.